We prepare in advance for your operation. This involves assessing your fitness for the operation, a process known as pre-assessment. The first stage of pre-assessment involves you completing a blue form. By answering the questions on this form, you will be giving us information about your medical health. At your clinic appointment, we will measure your blood pressure, pulse, and the oxygen level in your blood. We will also measure your height and weight. Swabs will be taken to check for MRSA. This is done by wiping a small cotton bud-like swab in your nose, in your mouth, and in your armpit. If it is felt that you need any blood tests, then these will be arranged. The pre-assessment nurses will look at your completed form and the results of any blood tests done to decide whether you need a further pre-assessment appointment. You will be provided with a leaflet about what you need to know when you come into the hospital for surgery. This will give you some information about having an anaesthetic and some telephone numbers you could call if you have any further questions. You may not need a further pre-assessment appointment because we have sufficient information about you. Some people will need further assessment of their health in preparation for having an anaesthetic. This may be in the pre-assessment clinic or by telephone. At this appointment, you will be asked some questions which relate to having a general anaesthetic. You will be asked which medications you are taking, so please have a list of your medications available. Some patients will have an ECG performed, which will provide us with a trace of your heart. You may be given information about stopping some of your medications before your operation, if it is felt necessary. The pre-assessment team can liaise with the anaesthetic team if there are any issues with your health, so that plans can be put in place in time for your operation. During the COVID pandemic, this appointment may be adapted to be done over the telephone, and any investigations needed will be arranged separately.